The next anti-epileptic drug or anticonvulsant is valproic acid. So basically, it suppresses CNS, just like all the other anti-epileptics or anticonvulsants, whatever you call it. Its main thing is avoid abrupt withdrawal. Plasma, you can monitor the plasma levels to get a target dose of what the individual is, but it's highly individualized. What I found is 50 to 100 micrograms per milliliter helps you get to that target to know like an idea, but it's not a narrow therapeutic dose. The baseline liver function is a must. You need for valproic acid to get your liver function. Do not give this to patients with liver failure. There is fatal liver failure injuries associated with this drug. Also, do not give to the children under 3 years of age. I'm pretty sure phenobarbital said, no younger than 12 years of age. Well, valproic acid says no younger than 3 years of age, okay? Take these orals with meals and do not crush. So I guess it's probably enteric-coated just because it's associated with this GI complications of nausea and vomiting, which is transient, actually. So these GI transient is an adverse effect of nausea and vomiting, so I'm sure that they try to make it enteric-coated. All right, so fatal liver damage is the adverse effect, that transient complications of nausea and vomiting. Hyperammonium is also a complication. That's one of them. Increase of valproic acid, if it's taken with phenobarbital, it increases phenobarbital in your plasma levels. So that's something to know. And another thing is neural tube defects. This is what it can cause for patients that are pregnant. Really important to know. So obviously it's advised if a patient chooses to become pregnant that they're going to still need to take that seizure medication, most likely, because the risks outweigh the cons of having defects, birth defects. But so those neural tube defects, they're going to advise 5 milligrams of folic acid to try to avoid these neural tube defects that can cause harm to the fetus. It's all anticonvulsants are actually class D pregnancy class. So yeah, just know that teach your patient about the risks. If a patient cannot swallow like a pediatric, just call the pharmacist for a different form, but know that if it's like, let's say it is in liquid, it's probably going to cause that GI upsetness, just warn them. So the 3 things I want to focus on of complications is your liver damage, your pancreatitis, and your hyperammonium. So your liver damage, what signs and symptoms are you going to be looking for? Reduced appetite, malaise, nausea. Let me say it one more time. Reduced appetite, malaise, nausea, abdominal pain, and your jaundice, like your yellow skin, but we kind of know that like bilirubin. So reduced appetite, malaise, nausea, abdominal pain, and jaundice is associated with liver damage. Your pancreatitis is going to be your abdominal pain also, your nausea and vomiting, and your anorexia. Hyperammonium is going to be vomiting, lethargy, and altered level conscious. So these are the 3 main things: liver damage, pancreatitis, and hyperammonium associated with valproic acid. Remember, for those pregnant ladies, to teach them to take 5 milligrams of folic acid. Inform them about the risks of valproic acid when a mother's pregnant, and and to consult with their doctor what they should be doing. All right, so that's everything, and do not take with for children under 3 years of age, and get that liver baseline checked out because it's fatal, and also do not give to patients who even have liver failure. All right, check it out. Bye.